4.
Good afternoon. How can I help you today?
I'm going to be travelling in a couple of months, end of June to be more precise, and I may need some vaccinations.
Where exactly are you going?
I'm going to Kenya and Uganda.
That certainly sounds like an interesting trip. How long will you be away?
About 2 months.
Fantastic. Is it for tourism?
Work related. I'm a biologist, and I'm doing some research with a UN group looking at the impact of climate change in a few areas.
Sounds like a very interesting project.
I'm quite excited about it.
So you will definitely need a few vaccines.
Yes, I've a list of recommended vaccines that was sent to me. It says here I need yellow fever, an anti-malarial, and I have to be up to date with other vaccines.
Do you have a vaccination record with you?
I have it right here. Here you go.
All right, let's see. It seems that you haven't had a tetanus shot recently.
Do I need a booster?
Yes, definitely. That I can give you today.
What about the yellow fever? Can I get that done now?
Unfortunately, you'll have to go to a special travel clinic to get that one. I'll give you the phone number so you can make an appointment.
Okay, how about the anti-malarial medication?
I'll give you a prescription for it.
Great, that'll be perfect.
The yellow fever vaccine should be done at least 10 days before you travel. Be sure to call the clinic as soon as possible to get an appointment.
King. Doctor, there's a Mrs. Speck on the line. Her 11-year-old daughter, Becky, has a fever and is complaining of a very sore throat.
How long has she had these symptoms?
She claims they come on suddenly.
Any other symptoms?
She said she's got a nasty headache.
Can she come in today? Sounds like strep throat, but I've got to examine her.
There's no room. We're booked solid.
Ask her to come in the afternoon. I think we can get her in.
All right, I'll have her come in. I might be able to squeeze her in late afternoon before 5 p.m.
Have a look at the 62.
2.
I was wondering if you can have a look at the 62-year-old female patient in room 12. She was brought in this morning.
What is she presenting with?
Shortness of breath.
Sudden onset?
Last few days.
Any other issues?
BP 180/100. Oxygen saturation 92%.
Has she been on medication for hypertension?
Prescribed previously, but the patient is non-compliant.
Anything else in medical history?
Previous pack-a-day smoker. Quit 3 years ago.
All right. Send me the file and I'll check on her in 10 minutes.
Thanks. Much appreciated.
3.
What brings you here today?
I've had some kind of reaction. I've got a rash and my throat is feeling strange.
Do you feel short of breath?
Not really. My throat feels sore and I've got these red patches on my face.
Can you please open your mouth?
Okay.
When did the symptoms start?
About 45 minutes ago.
Is the rash anywhere else on your body?
Yes, here on my arms. It's so itchy.
Do you have a history of allergies?
No, my mother has a shellfish allergy, but I haven't had problems before.
Did you eat anything out of the ordinary?
No. I mean, I ate some seafood at lunch, but I didn't eat anything I hadn't had before.
What exactly did you eat?
Oysters.
Raw?
Yes, is that a problem?
Possibly. Anything else?
Well, I also had some crab.
Okay. I'm going to give you an antihistamine. I'm concerned about your symptoms, particularly your throat.
Okay.
Is there anything else you drank or ate in the past couple of hours?
I had a coffee.
I'll send you for allergy testing. Since your mother has allergies, there is a chance you may also be developing allergies.
Oh no. I sure hope not.
Until you get tested, I would avoid seafood for the time being. I'm also going to prescribe an EpiPen that you should carry with you should this ever happen again. Are you familiar with this device?
Yes, my mother carries one. I know how to use it.
That's good. Now, I'd like to ask you to stay in the waiting area for about 30 minutes or so. We just want to make sure that your symptoms subside before you go.
Okay. Will you come and let me know when I can leave?
Yes, indeed.